Tonight we're hearing from a woman who tested positive for COVID-19 5 months ago, and she still has debilitating symptoms.
Fox 12's Audrey WEIL is live for us tonight in Southeast Portland to share that woman's journey and her message to everybody else. Audrey?
Right. Well, we actually connected with Chelsea Aliona through the governor's office after the governor tweeted about her story. Aliona is 37 years old. She lives in Kaiser. She says she was perfectly healthy until March. Then she started feeling symptoms and then tested positive for COVID-19 in April. She's had more than 80 doctor's appointments since then, and she is still so sick that she struggles to do her work. She can barely do any exercise. Sometimes it's hard for her to even stay awake all day.
Hiking, paddleboarding, anything that requires my heart rate to increase is off the table.
Chelsea Aliona simply cannot do things as she used to.
I certainly cannot work at full capacity. My brain fog is really debilitating.
She has fatigue, joint pain, hearing loss, many other symptoms that come and go, and perhaps worst of all, chest pain.
It wakes me up in the night. It plagues me throughout every day.
She tells me her symptoms started with what she thought was a migraine back in March. Things only got worse from there, and she says she finally qualified for a COVID-19 test in April that came back positive. More than 80 doctor's appointments, including hospital visits later, she's still sick.
Just everything is a battle. The mental health piece, the toll that it takes on us, the healthcare piece, the fact that it's solitary, the fact that everything is an unknown, the fact that we still have to try to this day to convince people to just wear a mask, to stay home, to socially distance.
What also bothers her is the lack of information, resources, support, and even acknowledgement of those who've become known as COVID long haulers.
My doctors feel that I'm not sick. I really feel like whether it takes 3 years, 5 years, whatever it is, I think that the medical community is going to come back, and I think that they are going to apologize to long haulers.
Oregon Health Authority Dr. Ann Thomas says the state doesn't have data on long-term effects of COVID-19. So much research has gone into the initial fight against the virus and figuring out immediate life-saving information. Plus, a lot of time and logistics go into a study like that, including following up with people every few months. This disease is still relatively new, but she says that kind of study could be done at this point and is likely beyond the state health department's scope.
I think it's important that it gets done because we're all, wondering just how big what are the long-term problems, that we're going to see from this pandemic.
OHA does have some recovery data. Health officials checked in on more than 1,800 of some of the state's first COVID-19 patients. Nearly 90% of them are considered recovered. Less than 1% have not yet recovered, and the state doesn't have data for about 10% of them. They count recovery as 3 days after initial symptoms go away. For the most part, those who had symptoms but weren't hospitalized took about 20 days to recover. Those who were hospitalized took about 26 days. Aliona says she hopes sharing her story helps get the word out that there are other people in her situation months after their diagnosis.
I've never been so pale in my entire life. I've never had these dark circles like this before. We need to be tracked. Long haulers need to be tracked because we are not recovered.
And Aliona is part of support groups for long haulers. She's also helping work to test out an app to track some of those long-term symptoms. Reporting live in Southeast Portland, Audrey WEIL, Fox 12 Oregon.